Do you suffer from back pain, neck pain, knee pain, neuropathies, or degenerative joints? Have you been told that you may need surgery? Join us at our next educational lecture on stem cell therapy and regenerative medicine. Learn how this fastest growing branch of medicine is helping thousands of people across the country eliminate pain and avoid needless surgery. Click the link below to reserve your seat at our free lecture. Don't miss this opportunity, as we always fill up fast.
Every 2 days, my body makes about 32,000 cells. That's pretty good, right? But if I'm losing like 38,000 cells, it's not so good. If I lose 40,000 cells every day of skin alone, that's not so good, right? So we age. Real quick, we age.
I'm Robin Russell, and I'm from Myrtle Beach.
And I'm Tillman Smith. I'm from Myrtle Beach too.
Today I found out that there's hope for people who are in constant pain and have nowhere else to turn, and hope for people that only have the option of surgery. There's something else.
My name's Craig Davis. I'm a retired registered nurse from Lancaster, Pennsylvania. I have had multiple spinal surgeries, and I was surprised to find out that you could actually do treatments for both of our spine conditions.
I thought the slide presentation was tremendous. Dr. Mike, he is fabulous. Very educational, very worthwhile.
I absolutely would do it and want to do it and will do it.
And he's very engaging, he's very charismatic, so he made the lecture very entertaining.
If you've ever been diagnosed with having any type of knee surgery, I would recommend check out Stem Cell first. This is something you're thinking about, just don't wait, just do it.
But the way I looked at it is, I would do the stem cell therapy. I could always have the joint replacement. That's always could have been a plan B for the future or whatever, but I'm very positive about it. Very.